Classification of seizure. Seizure mainly classified as partial seizure and generalized seizure. The partial seizure, otherwise known as focal lesions, there will be a focal origin for this seizure, and it is again divided into simple partial seizure or complex partial seizure. Generalized seizure again divided into tonic-clonic or grand mal seizure, atonic seizure, myoclonic seizure, clonic, tonic, and absence or petit mal seizure. Generalized seizure involve both sides of brain and are characterized by bilateral, synchronous, epileptic discharges in the brain from the onset of seizure. Entire brain is affected with the onset of seizure. So there is no warning sign such as there is no aura in this generalized seizure. Most case patient lose consciousness for few seconds to minutes. There are different types of generalized seizures, that is tonic-clonic seizures or grand mal seizures, then absence seizure, myoclonic seizure, tonic seizures, clonic seizures, and atonic seizure. Tonic-clonic seizure. The most common generalized seizure is tonic-clonic seizure. It is otherwise known as grand mal seizure. Tonic-clonic seizure, it is characterized by loss of consciousness and falling to the ground if the patient is in upright, followed by stiffening of the body, that is the tonic phase, for 10 to 20 seconds, and subsequent jerking of the extremities, that is clonic phase, for another 30 to 40 seconds. The patient may have cyanosis, excessive salivation, tongue or cheek biting, incontinence. In the post-ictal phase of this patient, usually has muscle soreness, and the patient may very tired and may sleep for several hours. Some patients have no memory of seizure. So that is regarding the tonic-clonic seizure or the grand mal seizure. Next one, absent seizure. Absent seizure, two types are the typical and atypical. Absent seizure, otherwise known as petit mal seizure. It is occurs in children and rarely continues to adolescent stage. This seizure usually stops when the child is mature. The typical manifestation of this seizure is brief staring spell that lasts only for few seconds. It often occurs unnoticed. Extremely, there will be brief loss of consciousness. When untreated, the seizure may occur 100 times a day. Some patients may have lip smacking, involuntary movements of hands, or fluttering of eyelids. When we are observing EEG, the EEG will be demonstrate three heads, spike, and verb pattern that is unique to this type of seizure. This absent seizure often precipitated by hyperventilation or flashing of lights. In case of atypical absent seizure, it is characterized by staring spell accompanied by other signs and symptoms. Here there will be brief warning and peculiar behavior during seizure or confusion after a seizure. And in EEG, there will be uh, spike and verb patterns that usually less than 3 heads. So that's regarding typical absent seizure or the absent seizure or the petit mal seizure. Myoclonic seizure is a non-rhythmic jerk resulting from involuntary muscle twitching that normally target the upper extremities. After an episode, the patient may describe The perceived sensation is momentary electrical shock. So, in this myoclonic seizure, mainly characterized by sudden excessive jerk of the body, especially the upper extremities. The seizure may be very brief and may occur in clusters. A tonic seizure or drop attack involves either a tonic episode or paroxysmal loss of muscle tone and begins suddenly with the person falling to the ground. In this picture, you can see that a head may drop and loss of muscle control and the person fall forward. Consciousness usually returns by the time of person hit the ground. Normal activity can be resumed immediately, but the patients with this type of seizure, greater risk of head injury, and we have to advise for protective helmets. Tonic seizure involves a sudden onset of maintained increased tone in the extensor muscle. This patient often fall. Sustained tonic muscle extension and stiffening will be occurs in tonic seizure. But in case of clonic seizure, it begins with loss of consciousness and sudden loss of muscle tone allowed by limb jerking that may or may not be symmetric. Here there will be sustained muscle contraction alternating with relaxation. Jerky movements are important feature in clonic seizure.